Hey everyone, welcome to the Health Tech Edge. I'm Mike Moore, and today we're digging into a challenge that often gets overlooked but affects almost every aspect of care delivery. It's task management. Even with all the talk about digital transformation and AI, the reality for many healthcare teams is this: they're still managing critical work with email threads, spreadsheets, and sticky notes. That creates friction, it wastes time, it also places a burden on clinicians and staff, contributing to burnout and care delays. Joining me today is Dr. Michael Docktor. Mike's a practicing pediatric gastroenterologist, an experienced digital health leader, and the CEO and co-founder of Doc Health, a company focused on improving how healthcare teams manage and coordinate their work. Mike, welcome to the show.
Thank you so much for having me.
Now, today won't be a product pitch. We're going to talk about some real operational pain points and how rethinking task management can be the first step towards real productivity in healthcare. And Mike, you know this all firsthand. As I mentioned, you're a practicing pediatric gastroenterologist, years as a physician, as an innovation leader, and now a startup founder. So you've seen it from all facets. What made you first realize task management wasn't just an annoyance, but something that was kind of a fundamental or foundational issue worth solving?
Yeah, thanks, Mike. First and foremost, as a full time clinician at Boston Children's, I was doing my best to take care of children with chronic disease, and I think there's this sort of background of all the tasks that we have to manage that really is just a foreign concept in healthcare. I think we have, as you mentioned earlier, we have our post-it notes, we all have our little check boxes, but there's really no grand concept of tasking in healthcare. And I think I had the benefit of working in the innovation group, as you mentioned, and informatics, and we were managing software projects with task management and project management tools, and sort of the light bulb went off. Like, wow, patients are projects in many ways, and furthermore, there are these great tools out there that every other industry has developed and has transformed those industries, where people have clarity on like what needs to be done for this project, and that was missing in healthcare. And so that was the sort of great moment where we decided like this is something worth leaving my full-time job as a GI doc to go and pursue, which is how do we better care for patients? How do we better care for the clinical and administrative folks that manage those patients by being more clear about what needs to be done and making sure everyone's accountable and visible and has all the tools necessary to do their best work.
Yeah, that makes sense. Yeah, I think about the last time that my mother was in the hospital, and one of the doctors came in and took from her lab coat, uh, 8.5 by 11 sheet of paper that was folded in half and kind of wrote on the back of it as she was talking to my mother about, whatever questions she had and whatever responses my mother was giving. And you're kind of wondering, especially working in tech, with all the information and all that, we've got the EHR system and there's computers on rolling carts, and all these kind of things, where does that information go? And you hope that the follow-ups that the doctor was describing in those tasks, right, are going to kind of make it where they need to make it so that all the tests get ordered or the new medications or therapies or whatever. So, um, tasks, I'm sure, from a clinician's point of view, are kind of big and small things, right? So, some of those are really critical to the patient care and some of those are maybe more administrative. So, how do you think about tasks and kind of categorization or evaluating the value of those? And is there kind of a system that you've developed or that you subscribe to for that?
Yeah, I mean, I think it does start with just that the fundamentals, as you described. There are so many sort of tasks that are in the ether that like we sort of cross our fingers and close our eyes and hope for the best in healthcare. And that's sort of if any other industry ran like that, it would be you know a significant problem. And so I think starting with the realization that there is a clinical intent or a clinical event that we need to get a patient to radiology for an x-ray, or we need to refer a patient out to a specialist. That's an intent by a clinician, and there's just so much downstream stuff that has to happen. Documents need to be transferred, data needs to move from one place to the next. People in the front office and back office of organizations, and often crossing organizations, need to do work to actually ensure that that person gets to the starting line, or ideally to the finish line of that care journey. And again, we go on blind faith for so much of this. So the electronic health record is fantastic at being a source of truth for the clinical information, the order itself, the intent, the sort of documentation around that, the actual results of that stuff. But there's so much in between that we haven't really captured. And so for us, it's all about, wrapping our heads around what are the, the best practices and the processes around that clinical intent or event, building the structure, accountability, visibility around that process. And ideally automating as much of that stuff so that the things actually get done, and we're not relying on humans to do all that work, which is largely administrative, operational, and mundane, frankly.
Yeah, yeah, that makes sense. And I think that, we've all experienced this as patients or as family members, as I described kind of my own experience, watching the doctor come in. But it is simple things like, even if you go to your primary care and they write on a slip of paper to have you walk out and schedule your next appointment or your annual physical or something like that, like there is a level of automation or workflows that can come in for all of this. So when you think about that and kind of, from the clinician, and kind of the tasks, utilizing some sort of better software or using software, right, to do kind of task capture and then the workflow piece. How do you start thinking about the productivity and kind of the flow and how all of this stuff should move through a healthcare organization?
Yeah, well, we spend a lot of time with organizations, really forcing them to think about their processes. And the reality is, even the best organizations out there don't really have a well-defined process. Many of them have, a workflow laminated on a sheet somewhere on a thumbtack board. And I think, or a number of post-it notes that are stuck to their desktop to sort of like remind them of a process. But the reality is that most organizations don't really understand what is their best practice around an administrative or operational flow. And certainly we spent a lot of time on the clinical guidelines and the protocols and such, for best practices in that sense, but we don't have administrative and operational best practices in healthcare. And I think, again, we sort of go on blind faith a lot of the time that I put in the order, so that stuff's going to get done. And that, frankly, just to go back to an earlier point, was the source of my burnout, and why I'm here today was really, there's just so much that we sort of like, throw, over the wall and hope for the best. But I took an oath as a physician to, ensure that those things are done for my patient. And unfortunately, you document your note and you put in your assessment and plan and you put in your tasks and you move on to the next patient. And there are several tasks in each of those, notes that ultimately get buried. And we move on to the next one. And that sort of on a Friday afternoon, walking out of clinic, there's many things that we've forgotten. And so how do we offload that? How do we delegate tasks? How do we sort of capture the things that were in these clinical notes that would otherwise be things that fall through the cracks? And how do we ensure highly reliable care for your mom and other patients?
Yeah. And I think, those tasks, a lot of people probably would look at it and say, well, there's EHR software, right? Whether it's Epic or, Point Click Care or all the different products that are out there in the market. Um, one could easily say like, well, why is there a need for other set of tools? Shouldn't EHR be able to do that? Doesn't EHR do that today? Um, but I think what I'm hearing from you is that it doesn't. So help,
Yeah,
those of us who don't spend their, like we all see the backs of our doctors, right? When we go into a lot of these
sure.
exam rooms or whatever, right? And they're on, Epic and kind of sitting there and going through it or whatever the EHR product is. Um, so it seems like there's clearly a gap between what that software captures and what you believe needs to happen, and that's where you see that there's a category or kind of an opportunity here for some other software
Yeah.
that clinicians will use.
Yeah. I mean, keep me honest here, because I can go on for a while on this one. But yeah, I guess first and foremost, the electronic health records. This is the great fallacy that they are sort of focused on tasks. I think uh, they're wonderful systems. We spend a lot of time in them. They again document well. They prescribe well. They bill well. And if you look at any healthcare organization, large and small alike, they all have these other things that they use, right? They use email, and we coordinate care with reply all emails, and we have spreadsheets and paper checklists for all the stuff that we have to do outside the EHR. And the reality is very little data is captured on that. Very little of that is automated. Very little of that is coordinated and collaborated on. And so, absolutely, there is another system. There's this administrative half of healthcare that is not accounted for, administrative and operational half that is not accounted for in the electronic health record. They have often a very vague concept of task, which is really a reminder. There's no collaboration, there's no accountability around that. And so, fundamentally, we believe that there needs to be a tasking solution in healthcare. I think we're the first to really, go big with that concept. And I think I'll be a little bit provocative for a minute and say, I'm a technologist at heart. I love new tools. I think, I was at the early days of Nuance at Boston Children's Hospital as the clinical lead in that project. And I'm excited about all the sort of ambient technologies that are out there. But as with every technology, there are unintended consequences. And I truly believe that, while documentation has gotten easier and reduced the burden, and that's awesome, we've made it easier to just throw stuff into a note, like orders and events and ultimately tasks that just get buried more easily because we haven't really, intentionally crafted our notes and written things down with our hands and burned it into our brain. And so it's just, become a dumping ground for more tasks to fall through the cracks. And so I think for us, it is about, surfacing those tasks, ensuring that those things have accountability around them to get, done by the right people. And ideally, if some of those tasks can be automated, great.
Yeah. So I think one question that pops up in my mind is, if I'm a healthcare leader and I'm listening to this podcast, I might have the question like, is he talking about us, right? Like, is this something that you see universally across healthcare, uh, delivery, methods and kind of different channels, or is it something that you think is only in certain organizations?
It is everywhere, and I think that there are some sophisticated, virtual first health tech companies that have been more thoughtful about building, systems around this because they, have the wherewithal to be lean and be thoughtful about their technology stack, and so they pick an EHR and they pick an operational backbone, and that is often us because these folks have used, oftentimes they're product and engineering people that are familiar with the tools of Jira for engineers and Monday and Asana and Trello for product people to manage projects. And so those are the standouts. But from small mental health and concierge practices and primary care that we help with to hospitals and health systems, they all have the same problem. Is they don't have process defined. They don't have an operational or administrative backbone or orchestration layer to manage all the tasks. And they all are using Excel files, post-it notes, fax machines. I mean, 80% of referrals at the top hospitals in the country are coming in by fax, and people are manually transcribing those faxes, and they're transcribing it into the electronic health record, and they're manually emailing a patient to say thanks for the referral or a referring provider. These are all readily automatable tasks and processes that we can create structure around, and again, ideally, reduce the burden on the care team, and the care team, broadly speaking, clinical and administrative alike, improve the patient experience, improve provider experience, put people's oxygen masks on first so that they can take care of themselves, by reducing that administrative burden that is often just painful, and sadly things fall through the cracks all the time.
Yeah, and we've been talking a lot about the clinician point of view and kind of the clinician experience, but I think what you just brought up is, there is the rest of the organization, right? Like the administrative personnel, the medical assistants, the nurses, everyone else who's in under that roof, right? And kind of how they all perform their roles and do so in an efficient way, because there's got to be frustration and burnout happening in those different functions, not just the doctors, nurse practitioners, physicians assistants, right? Like
Oh,
there's a
for
lot of
sure.
others who are kind of frustrated. And so there's an opportunity here to kind of solve for many needs that ultimately, if all goes well, benefits the patient, right? And kind
For
of,
sure.
what we're trying to do to improve care.
There's a, sorry to interrupt you, but there's a real focus on the clinician burnout, and it's super real, and I don't want to diminish that at all. And again, part of the reason why I'm here, but part of it, and I think it's under recognized, particularly for the clinical side, is like it's the administrative stuff that no one wants to be doing. Even the administrative folks, because a lot of it is mundane and routine and can easily be farmed out to technology, where they can focus on those important patient interactions, where we're human to human and we're talking and we're supporting, and we're you know there's a reason why people went into healthcare. It wasn't to do the administrative stuff, and I think there's an opportunity there, so we're excited about it.
Yeah. So when we look at some of the the customers that you're working with already and they're adopting this task management system, what are some of the benefits that they're seeing as they introduce it and kind of get up and running and get everybody on board from a use of the tool point of view?
Yeah, I mean, it's multi-factor, right? They're seeing efficiencies just in the sort of administration of that work, right? So you take again referral management as an example. You have a process that is highly laborious from a manual perspective. You're ingesting, you're literally taking a fax off of a pile of paper. You're transcribing that into the electronic health record. You're then, either calling a patient or sending them an email. You're sending a email to the referring provider. This takes an hour or two per patient with collectively for all of that administrative work, which largely can be automated. And so we're seeing benefits where that process, instead of a 2-hour process, is a 2-minute process where we're using AI to ingest the data from a fax. We're automatically creating a record for the patient in the EHR. We're automatically sending an email to the provider, based on whether they are an appropriate patient or not. Those are just simple, again, moving data around, automating tasks, creating the sort of preferred path of a workflow. And so seeing obviously administrative gains there. And then of course you improve throughput using referral management as an example. You improve throughput, you improve access, you improve the sort of referring provider experience, you improve the people who are managing this process, because instead of doing all that manual stuff, they're now focused on those few phone calls that they have to make to patients and keeping people in those seats. Those are, again, back to the burnout point. The folks in those administrative roles, they turn over really fast. It's super hard to keep people in that role because it's a difficult job. And you have, angry people who are waiting for weeks for, a referral to come through because it's sitting on a pile of, fax paper.
Yeah. And well, there's so much opportunity around all of this and kind of the automation and the workflows. And like you talked about, AI can help ingest, from a document and kind of turn things into the referrals and all of that good stuff. So, uh, and there's AI in kind of every product, right, that's being released or is being updated in the market today. There's you mentioned Nuance and kind of the ambient documentation. Microsoft has acquired Nuance several years ago. They've now, of course, revved that product. I mean, even we use meeting note takers when we have conversations, right, at work, and whether it's Zoom or Google or Microsoft, like they all do a pretty good job of capturing these things. Now, kind of next level progression of those things is, capturing things and then the agentic assistance that would then kind of kick off workflows or creating tasks and all that. But from your point of view and kind of the work both that you've done in the hospital environment as well as, now with Doc Health, what's kind of foundational, like you probably can't just drop those tools in the middle of a healthcare organization and expect everything to flow nicely. Is there kind of a maturity curve or a progression where you recommend customers start with those solutions and then kind of grow into more sophisticated systems?
Yeah, I mean, we certainly ascribe to the crawl, walk, run mentality. Healthcare change management is the largest problem that we face. Never mind the incumbent technologies. Again, our largest competitors are the Post-it note, then the Excel file, and of course the belief that the EHR solves all these problems, which we know it doesn't. But I think it's all about first starting with the process. There needs to be leadership buy-in that, okay, we've established that we have a burdensome problem where things are falling through the cracks. How do we fix this administrative or operational challenge? And so there's first a buy-in that accept that there is a problem. Then there's the, okay, let's sit down, and we have a very heavy consultative model where we come in with to an organization with a clinical and administrative experienced folks and help an organization define their process. And then of course we work with them to create the preferred path of what that process looks like. What are the stakeholders that need to be involved? What are the systems that we need to integrate in order to automate that process, and over time dial up the sort of level of automation and the sort of workflows and processes that we tackle. So we typically start with just a few pain points. Again, referral management is a very hot one right now, but is it prescription refill problem, or is it another sort of administrative or operational challenge that has some clinical intent, following up on abnormal lab results or whatever the case may be. Again, drive the process, define it, ensure that we have all the stakeholders involved, and provide value as quickly as possible, so that people, the more that we can automate, the more people, can look at it and be like, wow, this is amazing. I used to do this thing manually. It took me 20 minutes and now it's happening automatically. And of course, keeping humans in the loop and ensuring that they're part of the process, and have visibility to where the process is in flight, I think is essential. So yeah, starting small, chipping away. That's sort of how we've approached it today.
Yeah, and I think the point that you just made about humans in the loop, which is a common phrase we hear in AI, it was talking about tool adoption or those kind of things, especially in healthcare. There have been some well-publicized cases where humans were not in the loop and AI was making decisions about claims or care or other kind of administrative things that had an impact on patients and health plan members. And now there's legislation either passed or pending in different geographies about kind of making sure that humans remain in the loop so that and I think that's kind of what a lot of us advocate for these tools is like AI can be a powerful tool just like ChatGPT can be a great writing assistant. These kind of AI powered tools for healthcare can be a powerful assistant to clinicians or administrators or whoever in a healthcare organization, connecting the dots, things that we know we want to do, but because they're overburdened or whatever the issue are, just not connecting. And now there's an opportunity to serve that information up so that a human can take a look at it and say, yes, that's exactly what we would have wanted. That's exactly what we want to do. And we can kind of hit the button to make it kind of move on to the next step in the workflow. So very exciting. So kind of parting thoughts here, if you were to give some advice to healthcare leaders as they think about task management and kind of the evolution into AI and agents and all of that stuff, what would you share with them, Mike?
Yeah, I mean, first and foremost, I think let's first acknowledge that there is a problem, or there are some challenges, areas that we could improve, and I think acknowledging that the electronic health record hasn't solved this problem, that there's an entire workforce of administrative and operational people that want to support the clinical teams but don't have the right tools. And so, the EHRs, wonderful clinical tool, the administrative and operational people can't live in there, and they've sort of ultimately, found the best things that they can at the moment, which is, Excel files, post-it notes, and paper checklists. So acknowledge that there's a problem, and work with your organization to define what is our preferred path, what is the best practice. How do we define, again, in our belief, tasks are the fundamental essence of care. Those tasks roll up into workflows that are really best practices. And then how much of those workflows can we automate or agentify, right? We're super excited about the ability to leverage AI agents as the doers of some of these tasks, and creating that framework that allows visibility and accountability and efficiency around that flow. But I think it is important for, again, people to sit down to define their process. Who are the key players? What is the sort of happy path look like? And then how much of that can we integrate and automate and potentially agentify with, if that's a word, with this really exciting wave of technology that's coming our way, and has benefited many organizations and many industries outside of healthcare. Healthcare typically takes a very long time to adopt technology, but I think the opportunity is upon us to really take advantage of this.
Yeah, it's great advice. So thank you, Mike, for your time. It's been great to have you on the show today.
Thank you for having me. Great opportunity, and look forward to chatting more.
Yeah, so we'll put some links into the show notes. So if folks want to dig deeper, they can find Mike and the team at Doc Health and learn more about this area of technology. And for everyone listening, if you found this information helpful, please share it with a colleague or leave us a review. So until next time, we'll thank you for having this great conversation on the Health Tech Edge.